Yes.
So obviously that can happen without being a yeast infection.
Right.
What do you feel is the protocol? Is douching safe? Is douching something to go to? What can women do? And is there a way that you can, if you start having vaginal itching and it might be going to a yeast, that you can curb it at home with home remedies before it full blown?
Yeah. Okay. Number one, we don't recommend douching.
Okay. Good.
The vagina has a very, very narrow, specific pH it needs to stay at for health, and douching most of the time will interfere with that.
Okay.
So we try to, for the most part, again, we try to tell people to leave the vagina alone, and it'll do okay most of the time on its own. Most of the time when a woman has a discharge with itching, the majority of the time it won't be yeast. There's bacterial causes that are more common than yeast. Now, the yeast remedies, most of them are over the counter. And again, I don't have a problem with that because, of course, most of the time it happens nights or weekends anyway.
Yes.
To at least experiment to see, because if you get better using a yeast medication, then it was yeast. If you don't, then it wasn't. They are universally responsive to those things. So if you try an over-the-counter remedy, the monostat, gynolotrim, and those types of things, and they don't work, then it's not yeast. Now, some other things that are important. Probiotics are awesome. I have no problem with people using those. They're great. I have no problem at all. There's also some other things that are available at the drugstore that are meant to help keep the pH in line. FemPH is one. There's lots of name brands. There's lots of different things that are available.
Oh, that is good to know.
And so those things are awesome too. So I would say those well ahead of any ever trying to douche or do anything like that.
Oh, that is good to know.
So there's lots of different remedies that are out there. So use the remedies that are going to help with the pH, the probiotics, the FemPH, things like that. I guess if a woman is absolutely desperate, vinegar is okay because vinegar is about the pH that the vagina needs to be at, but it's still better to use these other things. Most of the bacterial, or most of the vaginal infections are much more common when the pH is not right.
So is the FemPH and those things, is that something you take daily, or is it only take it if you're feeling off?
Most of them are maintenance, but you don't have to do them daily. Most of them are maybe once or twice a week and that type of thing.
Oh, okay. Oh, that is good to know. Sweet. All right. Why is sex sometimes, or for some women, always painful? And when should this be a concern that you see your doctor?
Mm-hmm. Painful intercourse is common. And again, there's a huge spectrum again. Some common things that can cause painful intercourse, endometriosis. If you've got this endometriosis on the inside of the pelvis, then sometimes when they're hit or traumatized during intercourse, they're going to hurt. So that's a common time. Sometimes women will hurt if they've had repairs after vaginal delivery. There can be some scar tissue or things like that can cause pain. But then again, there's also some other things. There's lots of things. If a woman has not had a good experience with sex, it's more likely to hurt. And so especially women who have been traumatized by even sexual assault or sexual abuse, so there can be lots of different things that are there. And so when should a woman seek medical care? She should seek medical care if the pain and discomfort is keeping her from being able to enjoy sex, or it's keeping her from being able to have the type of relationship she needs to have with her partner. Mm-hmm. So if it's getting to that point to where it's becoming a distraction, a concern, or anything like that, then she should be seen. And, like I said, we'll always start with an examination. There are some other things that we can do, ultrasound, whatever, just looking to see if there's any of those other anatomical causes. But there's also lots of good counselors in town who are great sex counselors, and that should never be minimized.
Yes. Oh, for sure. For sure. And I had a question come in that says, is it normal to bleed after like frequent, more kind of, say you had a weekend away and you had intercourse more often, when it's not your cycle? Is it normal to bleed after that?
That's not unusual. But again, it's probably not a bad idea to be seen, just to be seen, but just to be seen, to make sure everything anatomically is normal. But the uterus and cervix have a rich blood supply. If they're traumatized, for lack of a better word, during intercourse, that can bleed a little bit, and that's very common and not dangerous and not bad. Some other things, there can be endocervical polyps and other things that can sometimes do it too. So and those are easily taken care of, and so it's always a good idea to be seen. Postcoital bleeding is much more common with pregnancy than it is without, and that's again because the blood supply to the uterus and the cervix goes from about 75 cc's a minute when you're not pregnant up to about 600 cc's a minute when you are, and so all these vessels and things are much more engorged and so much more prone to bleeding. And so we get that a lot, especially first trimester women are coming in scared to death because they're bleeding. And fortunately, come to find out it was just because, some cervical blood vessel got irritated and bled a little bit. But postcoital bleeding is not uncommon. Yeah, you should be seen. You should be current on an annual exam, all those things to make sure everything is good. But it's 99% of the time nothing that anyone has to worry about.
Oh, good. Okay. What is classified normal vaginal discharge?
Normal vaginal discharge there's a wide spectrum, and a normal discharge should not have an odor and should not make you itch or burn.
Okay.
So if you have an odor and there's itching or burning, then you should be seen.
Okay. And how often should women be doing self-breast exams?
We recommend them monthly. That's the answer. And we try to tell them if they're cycling regularly on their own to do that exam 7 to 10 days after the period starts. That's when the breast is the least tender and the least lumpy. If they're not cycling on their own, so they've had a hysterectomy or ablation or they're postmenopausal, then you just pick a day of the month.
Okay. So what exactly are you looking for, especially for somebody that has fibrocystic breasts? It's like there's lots of lumps.
Yeah. So you're looking for the things that are worrisome or asymmetry. So most women with fibrocystic changes, how they feel in one breast are going to feel in the other. So you feel out there and say, oh yeah, there's some little lumps and bumps, and I feel here, oh yeah, there's lumps and bumps. So if it's symmetrical, if it's small, if it moves with the breast tissue and is sometimes painful, that's normal. So things that are growing, things that are asymmetrical, things that seem to be stuck to the muscle below. In other words, when you're doing your exam, you can't move that lump, but you go over it. Those are things to be concerned about. And the thing we hear all the time is say, I have so many lumps and bumps, I just can't do it because I don't know what I'm feeling for. And we try to encourage women to say that if you do it monthly, you'll get used to your own breasts. Yeah. And then you'll get to know, okay, this is normal, this is there, this is my normal thing. And so we still encourage women, even though they feel like it's lumpy bumpy, that they should do it.
Okay, that's good. All right, now we're going to just ask a few more questions on us lovely ladies that are getting older. I had one of my ladies say she's 40 years old. How often does she need checkup? She's done childbearing years.
Yeah, and there's a lot of things that are hard to understand because we've changed the way we do Pap smears now. And in a woman who's never had an abnormal Pap smear, otherwise low risk, we don't have to do a Pap smear each year. But it has been universally recommended that a woman still has an annual breast and pelvic exam. So an annual breast and pelvic exam is important. Whether a Pap smear is done at that annual exam, that's a different thing. It may not. But the annual breast and pelvic is still recommended. And obviously mammography starts routinely after age 40, colonoscopy after age 50, family risk factors, that type of thing.
Okay. What about if you've had a hysterectomy? Is that still the same, still yearly?
Yearly, especially if you had ovaries preserved. Now, if a woman's had all of her ovaries and everything out, is it absolutely critically important you have an annual pelvic exam? Probably not. And if she sees her primary care doctor, family practice internal medicine, they do an exam, that's probably okay. But there still are some things that can only be felt on a pelvic exam And so, I certainly wouldn't tell a woman to abandon them
Mm-hmm.
if she's had a hysterectomy with her ovaries removed. And for sure, if ovaries have been preserved, because you still need to have the exam.
That's what I have. I have a hysterectomy, but I still have both my ovaries.
Yeah.
So, okay. How do you know when you're starting menopause, and is it important to know? And is there anything to make it easier on your body, supplements, anything like that?
Exercise, diet, and sleep. But menopause is the definition of menopause is when the ovaries are no longer ovulating. It's different for every woman. The average age in America is 51 or so. The most common sign of menopause is cycle irregularities. Most of the time you start skipping months. And then of course there'll be other symptoms that women have, hot flashes and things like that. Is it important? Menopause is important because a lot of different things happen when a woman is menopausal. Estrogens does seem to be protective. We know it's protective for bone. It seems to be what keeps women's cholesterol a little bit better than men and things like that. So menopause does mean it's a time where there's more health concerns and important to continue to be seen regularly. As far as things that can make it easier, again, this menopause is a huge spectrum. And some people, I have women who come in who never had a hot flash. And then I have 76-year-old women who are still begging for hormones because their hot flashes never went away. And so it's different for everybody. Vaginal dryness, painful intercourse, those types of things certainly come with menopause. And there's lots of different ways to treat it, all the way from estrogen replacement to there's lots of over-the-counter things that are available. So again, it's an individual thing. And I was somewhat joking about the diet and exercise. That is important. Calcium supplementation, weight-bearing exercise, aerobic exercise, all those things are things that will help the physical things of menopause, and they also help the emotional and mental part too, for sure.
Okay. So like somebody who's had a hysterectomy or even still has an IUD in and that isn't having a period, you won't necessarily be able to notice. Like
Right.
I won't know unless I start having hot flashes.
Correct. That's right. Yeah, but we tell all women anyway in that perimenopausal time, starting in the late 30s, early 40s. Again, this is a time to concentrate, make sure your bones are maximally strong. Do the calcium supplementation, do the weight bearing. When you say weight bearing exercise, I'm not saying lifting weights. I'm talking about exercises that you are supporting your own weight, walking, running, those types of things. Those are things that are going to maximize your bone density, bone strength, because every woman, regardless of what she does when she goes through menopause, will lose some bone strength.
Oh, okay. Okay. All right, aging and sexuality. How does this change for women, and what complications do they run into?
Yeah, so obviously without estrogen and things like that, there's going to be less vaginal lubrication. And certainly as ovarian function goes down, there's going to be some issues with libido and other things that are completely normal, physiologic, explainable, normal things. And so there's lots of different things that can be available, all the way from estrogen replacement for some women to, water-soluble lubricants. There's lots of different things that are there. Again, a good conversation is important. Making sure everybody is aware of where you are and what's going on.
So is the most common issue once you're getting older, is it women not being able to, have their own lubrication, and they become more thin? I've heard, like your skin, right? The
vaginal skin becomes thin and atrophic, and that makes it to where it's going to, not only is there less lubrication, but there's less elasticity and things like that. So you're certainly more prone to some discomfort, and some women even have splitting of the skin and will bleed, and that of course freaks them out.
Yeah. So does Kegel exercise help with any of that?
Kegel exercises help with the musculature of the pelvic floor. They don't do anything for vascularity and elasticity and all those things. they're good. I don't discourage them. They're good.
Okay. So you do recommend women doing those.
Yeah.
So there's been a couple of times with me, it's only happened a few times, where I've had muscle spasms during intercourse in my vagina. Like I shut off.
Yeah.
What is that and what's it caused from?
So again, and a lot of that depends. There are some women who will have, if something was just hit just wrong, they'll have pain to where there's a natural response for that to happen. But there are some women too where, not just menopausal or things like that, young women where they will have some, and again, lots of this is just due to perhaps, lots of different reasons, but they'll have what's called vaginismus, where the vagina does just tighten up anytime any type of sexual relationship is initiated, and that is something that's an important thing for counseling, biofeedback, and some other things where she can learn to control some of those issues and things like that. But many women will have that response if for whatever reason there was some type of pain or irritation or whatever.
Okay. So unless it's a consistent thing, then there's not a lot to worry about.
Yeah. So if someone came in and said, this happened to me once, I would probably say, well, it's probably going to be sporadic or erratic, and it's not going to be a huge deal. Yes, we'll always do an exam, make sure we don't see or feel anything that's abnormal. But
okay. So the next part is bladder. So I had actually come into your office and I saw, I believe, is it Lisa that's your patient? I saw Lisa, who I was having some bladder issues, and she forwarded me on to another office here in town.
Okay.
And so I know you don't necessarily do the surgeries for bladder. You usually refer out. Is that correct?
Well, we do them, and gynecologists do them.
Okay.
And I do them, but many times I will refer people out for specific bladder testing. So before any woman has surgery on a bladder, for sure she needs some specific testing to test what, bladder function, bladder capacity, innervation, all those things. So those things absolutely need to be done prior to surgery. Because if someone just comes in and has surgery just based on history alone, up to 50% of women will get worse.
Oh.
And so again, I will many times refer people out to get some bladder testing, and many times do a combination approach. But there are many gynecologists here in town that'll do it all, and I think, and that's fine. I have no problem with that. I don't think there's a way that's better or worse. So if anyone's out there saying, well, my doctor didn't refer me to someone, that doesn't mean that's not right.
Okay.
Lots of people will do it, and I've done a million and have done them and continue to do them, but offer them other things too. So.
Okay. And when you do them, do you use the sling, or how do you repair bladders?
Well, most of the time it depends. There's two different things you're fixing with the bladder. You're fixing its anatomical location, and then you're also concerned with function. If a woman is leaking urine, so if she has stress incontinence, or she's leaking urine with cough, sneeze, exercise, that type of thing, most of the time in today's world they're going to require some type of a sling, because they've got to have something to support the bladder neck. Mm-hmm. So they've got to do something to help support the bladder neck. The rest of the stuff, as far as reducing the cystocele, supporting that bladder in the proper location, that can be done with lots of different things. Most people do not use mesh anymore for that, but can be done. But the anatomical location of the bladder and its function are different things. And if there's leakage, most people will require a sling.
Okay. So when I went in, I did find my bladder. Obviously, I had 5 kids. I am 45. It had fallen really far, he said. But also he talked, which I tried to understand as well as I could, that my urethra had dropped.
Hypermobile, yeah. So the urethra itself. See, the urethra is supposed to be supported up behind your pubic bone. Okay. And again, most of the time it's with women who have had children. That support gets interrupted, and again, that bladder falls below the level of the muscles, and so instead of those muscles providing support and keeping you from leaking, the force gets pushed right through the bladder and you leak. And so so you'll have a hypermobile urethra, and that's what's actually being supported by a sling. It's that part. It's the bladder neck where it goes into the urethra, supported by the sling.
Okay, so when you do the surgery, it actually gets lifted as well.
Correct.
Okay.
Yep.
So obviously bladder care is important. You would
Correct.
never recommend to a woman, I mean, I know women that have just lived with it
Mm-hmm.
and it's gotten, really bad. Is it okay to live with it, or is it something?
Most of the time it is not a dangerous thing.
Oh, okay. Okay.
Most of the time it's going to be bothersome.
Yeah.
So it's going to be more bothersome than worrisome.
Okay.
Now, so again, what I tell women is, just because someone tells you have a cystocele or a rectocele is not reason enough to have surgery. Again, it needs to be disruptive. I can't run anymore. It's difficult for us to have intercourse anymore. Various things. So anything that becomes, if it's disruptive and keeping you from doing the things that you need or want to do, then that's a time when it should be surgically corrected. Just because it's there does not mean it needs to be corrected.
Okay. Okay. That's good to know. Have you ever heard of the Mona Lisa laser treatment?
Yes.
Okay. I actually had that done.
Yeah.
At the office that I went to.
Right.
So I actually am super happy.
Right.
It completely lifted everything, including my urethra, and I'm not having the pain, because I was actually having a pain where it was like wondering, am I getting a bladder infection?
Yeah.
And he said it was from that urethra being too low.
Yeah.
For whatever.
What the Mona Lisa does in a simplistic thing is the Mona Lisa helps restore vascularity.
Mm-hmm.
And so if you've got normal vascularity, then you're going to have more normal skin turgor, elasticity, all those things that sometimes get are attenuated or less as a woman ages or whatever. So that's what Mona Lisa does, and I have no problem with it. If a woman wants to try it, I say let's try it. Because even if it doesn't work completely, it sometimes helps the tissue to be more ready if a woman requires surgery, because there's just the blood supply is better and things like that. So I think it's a nice procedure. It certainly is, again, safer than surgery, and certainly maybe worth a shot before someone says, okay, I've done everything and now it's time for me to have surgery.
Yeah. Well, that's good to know, because I was wondering what your opinion would be on it, because I want to make sure I'm doing something that's safe.
Yeah, it's safe.
So I didn't have any adverse effects with it whatsoever, and I have quit leaking. I mean, it's.
Yeah. So no, I think it's a fine thing for someone to consider, for sure.
Yeah. Okay. Cool. All right. Last question.
Okay.
Is as some women get older, I've heard. And I've been told, and I've actually experienced this myself, that their climaxes have gotten weaker.
Uh-huh.
Is that normal?
Yeah. Well, again, a lot of this is due to, yes, it's normal.
Okay.
But does not necessarily need to be inevitable.
Okay. Okay.
So, again, there may be some of those physiologic things. There may have been some disruption of blood supply, innervation, all those things to the clitoris. All those things which may affect it. And again, most of the time, again, it just requires more stimulation, more foreplay, because that's what brings in the blood supply and things like that. Now, again, if someone is having problems and they think it's well more than what it should be, and some of these other simple things don't help. Yes, be seen, be examined, make sure everything is normal. You'd hate to miss something that could potentially be easily fixed or addressed, whether it's hormonal levels or something anatomically abnormal. So yes, be seen if it's not, but know too that you're normal. Don't feel like you're the only person in the whole wide world this is happening to.
Yeah.
But there's no question that it does take more manual stimulation, more time, and things like that. And that's where the conversation with your partner is so important. To just say, and again, a majority of women, and I'm sure you guys already know this and you've talked about it, a majority of women do not have climax or whatever you want to call it, orgasm, when their partner does. It's usually a separate deal. because again, the same thing that may help a woman reach that is way different than what for a man.
Yes.
So that's also important for women to understand, is that, hey, why don't I ever have an orgasm? There may be some other things that need to happen. Just to be clear, that 99% of the world's women do not have orgasm with just normal penile intercourse.
Mm-hmm. Yeah, I think that's so important for women to understand that,
Yeah.
that you're not failing.
No. Uh-uh.
So there, and that's why the communication is so important.
Yep.
So important.
Yep. Absolutely.
Yes. All right. Well, what is your contact information for your office if any of these ladies say, well, I just want to have Dr. Lunt be my doctor. I want to go to his office if this happens.
Yeah. We have of course, our phone number, still probably the best way, 435-674-0999. We have a website that we can be contacted on. Our website also has just educational things too.
Oh, good.
And I think it even has that educational link to the ACOG site too. So our website is really good. And I'm trying to remember now. I think it's just the website is just called luntandcarford.com. But I think if you just get on, you do St. George OBGYN, we'll be there.
Okay. Yeah. I've also found, I think, if I'm on the right one, maybe Lunt and okay, St. George OBGYN.com staff, you came up.
Yes. Yeah. And I think I think someone just recently did some work on our website that made that to where it'll be. Yeah. You
probably have several different links to get to.
Yeah.
Awesome. Well, Dr. Lunt, this has been so informative. The ladies are going to love this. I so appreciate you.
Hopefully so.
Yes. A lot of times we get into our appointments with our doctors and we leave halfway going, oh, crud, I forgot to ask this and this and this. And
yeah.
So I was trying to hit some of those questions that we sometimes
And again, most doctors' offices aren't going to mind too. If a woman gets home and forgets something, just call back. Don't be embarrassed to call back and just say, hey, I forgot to ask this. And they'll get the information to them. So, most women's memories all of a sudden comes back when they get in the car and start it.
It's so true. So, would you mind telling the ladies that there's not a question they should be embarrassed to ask?
Oh no, I can guarantee we've been asked. I can guarantee it.
And that's what you're there for.
Yeah, and part of what we try to do now, and I think most of every office in town tries to do this very same thing. We try to talk in such a way that then women will say, oh, okay, so I'm not the only one, and so, yeah, there's not a question they shouldn't ask, because I can't remember the last time I heard a question that shocked me or that I hadn't heard.
Okay, that's good to know. So ladies, ask away when you go to your appointment.
Yeah. And in today's world too, when you simply just have to speak into your phone and make a list of questions, do that so you don't have to worry about it. Write them down if you're don't have the technology down, and bring them in, and in that way you don't forget.
Okay, great advice. Well, thank you so much for your time.
You're welcome.
Appreciate it.
Sorry it took a long time. I apologize for that.
You are totally fine. I am just so grateful we finally hooked up. Thank you.
Perfect. You're welcome.
All right. We'll talk to you soon.
Okay.
Bye-bye.